It is a great pleasure to be back with my old friends of AAPS. Jane and I go back to 1992 when we first started the fight against Clinton health care. And one of the things I have learned over these past 20 years is that almost every other association in Washington is willing to compromise and change its principles based upon the wins, except AAPS. It's sort of the plumb line out there. If you want to know what's right, you go to AAPS. If you want to know what's expedient, you go to the AMA, maybe somebody else. Well, Jane had mentioned it is tough coming to talk to a group like you because most of the times I talk about healthcare reform issues, I talk to people where you can explain what works and what doesn't work in healthcare. You can't do that with you. You already know what works and doesn't work. In fact, you're sending me emails frequently telling me what's working and what's not working out there. So Jane suggested we talk a little bit about some of the developments that are arising now with the repeal and replace efforts, some of the allies that we have out there, some of the things we can look forward to, and some of the challenges that we have. Some of the groups that we might have thought would help us in the healthcare reform battle, some of the associations simply never panned out. Back during the Clinton healthcare debate, several of them, AMA, AHA, what was HIA, Health Insurance Association of America then, now it's AHIP. Most of them were on the wrong side at first, but eventually came around. And I thought this time around they would eventually come around as well, and they didn't. And so we ended up seeing this thing where you had AMA, AHA, Pharma, AHIP, National Association of Health Underwriters. If anybody gets killed in this besides doctors, it's health insurance agents, and even the National Association of Health Underwriters never took a solid stand against the legislation. And when they came out with this $500 billion cut from Medicare, I thought to myself, well, now they lost AARP, silly me. Imagine what would happen if Republicans had proposed a $500 billion cut to Medicare. But they kept all those, and we've lost those associations, and my own feeling is if one or two of them had actually got the courage of its convictions and stood up, we might have been able to defeat this thing. But with all of those associations behind the administration, or at least staying politely silent, the legislation ended up passing. So we've got our legislation out there now. It has it has created a number of problems for us as we try to move forward with doing it. Now, I wanted to point out some of the things that I think we can work on in terms of trying to repeal or replace. The key thing out there is going to be the individual mandate. That's sort of the first one. I just found out today, I'd actually sent a piece off to the Wall Street Journal earlier this week. They sent a note back today saying they were going to run it. I don't know if it's tomorrow or Monday, but it's on. It basically starts out saying that if the President Obama would be wise to send a signal to the Republicans that he would be willing to support ending the individual mandate. It's become the signature provision of his signature legislation. And he never campaigned on it. He actually campaigned against it. And yet, look at the problems that the individual mandate has created for him. That it's created a backlash in the country against the whole health care bill, against Democrats, and it has created problems for his own poll numbers. And it has created, from our standpoint, there is this whole newfound interest in the Constitution. I mean, God bless the man. He's done all this terrible stuff, but he created a whole new interest in the Constitution. We have a statement, sometimes the Lord hits a straight lick with a crooked stick. And I can't think of anybody that a crooked stick applies better to than Barack Hussein Obama. Do you know that the government printing office just about a year ago put out a notice saying its most popular publication has become the U.S. Constitution. That's what they're having to keep reprinting because there's so much demand for it. You've got people going and looking at the Constitution, reading it, asking what it means, asking Democrats if they know what it means. If there is anything scary out there, it's listening to some of these Democrats explain what the Constitution means. I'm just stunned. Back January last year, when CNS News started going around saying, where in the Constitution is there an individual mandate? Where do you get the power for an individual mandate? Many of them would step, well, we require people to buy auto insurance. And it was never clear to me if they didn't understand that it's the states that require them to do it and not the federal government, or if the state constitutions are not the same as the federal Constitution. It's amazing that of these answers they came up with. And now this past week, we've seen them talking about the Constitution yet again, finding out the Equal Protection Clause from Sheila Jackson Lee apparently requires people to have health insurance. When you look at this, you say, and because if they don't have a mandate requiring them to have health insurance, then they can't get health care. She never made the connection that health insurance is not the same as health care, and therefore they die. It has been a very instructive thing on watching people respond to their understanding of the Constitution. So you got to thank President Obama for that part of it anyway. We now have a whole new public ready to go forward with the Constitution once again, and they apparently want to hold Washington's feet to the fire on making sure that things are going to be constitutional. If that happens, I don't think anything passes. And then, besides that, now we have this bizarre thing of 27 states that are suing the federal government based upon the constitutionality of the legislation. 20, then 6 more were added, then 28. That's absolutely right. 28 because if you add in Missouri, it's 28. 28 states challenged them. Oklahoma was they haven't done it yet, aren't they supposed to do it next week? If they do that, I think we're up to around 29. And you've got 6 states that have passed legislation telling them healthcare Freedom of Choice and Health Care Act telling the federal government, you can't tell us we have to have health insurance or fine us if we don't. 2 states have passed a state constitution. And as the state legislatures are moving now, I know North Dakota's doing it, Texas is doing, several, Idaho is looking at nullification stuff again. I mean, this is getting really interesting. So you have this bizarre thing of our constitutional scholar in the White House has created a whole constitutional flowering out there. Who would have thunk it? And he risked the threat of the constitutional scholar having his own legislation determined to be unconstitutional. So I think Barack Obama would be wise to go ahead and get rid of the individual mandate to save his prowess of being a constitutional scholar and perhaps squelch the notion to try to kill his whole legislation. And besides that, we have other elements. Senator Wyden and Senator Brown have introduced the Wyden-Brown legislation. The bill, and I didn't realize this, I missed it somewhere, but the bill allows states, if they meet certain qualifications, in 2017 to set aside the individual mandate. So the Wyden-Brown legislation says we can move this up to 2014 when the mandate starts. My guess is you will get a fair amount of Republican support for that. Not because it's necessarily good legislation, but because they're wanting to sign on to almost anything that nips away at this thing and makes it look bad. And if that's the case, it would be wise for the president to do that. Now, besides the whole constitutional aspect of it, you've got the replace and defunded efforts. Now, just in the last day or two, Speaker Boehner has handed the task to 4 of the major committees to go through the legislation as a committee and find various things that need to be, that they could reasonably defund or repeal or replace. It's a good place to start. He's moved it out to the committees. There are several defunding proposals going around. I've written some on it myself. Some other groups have put a list of things that you could defund. And I can tell you that the Department of Health and Human Services, even though Democrats are saying this isn't serious, Department of Health and Human Services is concerned about this. I don't know if you know this, but they had actually went out, I think it was to Maryland, got thousands and thousands of square feet of office space, paid 3 or 4 times what they had to because they had to get in a hurry. And they were staffing up an extra 200, 250 people to create a health insurance agency to sort of go over and look over all the things that were going on in health insurance. And Congress, yeah, job creation. Well, we know the president at least created 250 jobs out there. But that Congressman Burgess has been the only one that's really been tracking this thing, and he actually he told me last week he had a meeting with Dr. Berwick a few weeks ago, finally got an appointment with him to see him, and he said, where do y'all get the authority to do this? I mean, there's nothing in the legislation that allows you to go out and create a whole new agency out there with hiring hundreds of people and renting thousands and thousands of feet of office space to track the health insurance industry. And he said, Berwick told him, well, we think it's necessary, and we decided we would go ahead and do it. He said, well, where did you get the funding for that? And he said, well, we're just pulling out of HHS funds. And he said, you have enough funds left over in HHS to be able to fund a whole new sub-agency out there and buy all this office space? Maybe we can take care of that. So the news came out earlier this week that HHS is closing down that shop and moving them back into HHS buildings. Before you clap, they're not getting rid of it. They're moving it into HHS buildings because they think it will be harder to defund if it's not out there in a separate building. Kathleen Sebelius is a lot of things, but a fool she ain't. So they are looking at that. That's one of the things we want to look at in terms of that. There are 3 or 4 important things we ought to look at defunding. The first one, I think, the Independent Payment Advisory Board. We need to get rid of IPAB. That needs to be gone. The Class Act. If y'all don't know about the Class Act, this is the federal government's attempt to try to make the federal government the long-term care insurer in the country. This goes back about 5 years when Pete Sessions' staffer took me over to meet Connie Garner. This was Senator Kennedy's staffer in charge of putting together the Class Act. And she said, you know, we're trying to get input on this and so forth, and we feel like there's a problem with people who are disabled not being able to get insurance after they're disabled. Well, yeah, that would be a problem. And so we want to create this Class Act to address this problem. Under the initial proposal, everyone would pay voluntarily, but it's voluntary opt-out. You would be in unless you decide to opt out. Everybody was going to pay $30 a month, every worker. You'd have to be in the plan 5 years. Now notice that with regular health insurance, they feel like if you're sick, you ought to be able to go in immediately. But under the Class Act, you had to pay 5 years before you got any treatment. Any insurer would take that deal. But they wanted to, you were going to have to pay 5 years, and then once you paid 5 years, then if you had 1 or 2 ADLs, activities of daily living, if you needed help with 1 or 2, you would get $1,500 a month. 3 or more, you got $3,000 a month. And I said, well, how many people do you think are going to stay in this? Well, we said we did some sort of back of the envelope thinking about it, and we thought 90 to 95% of the public. Really? You think 90 to 95%, especially these young, healthy people who think nothing's ever going to happen to them? Yeah, that's exactly what we think. Okay. I said, you're not going to see us supporting it. But at any rate, it was their whole attempt to try to get the federal government to create a whole new entitlement program. Well, they decided to go ahead and put this in the legislation, not because Democrats decided they want it so badly, but because of the 5-year wait before anybody gets any benefits. It created a net add-on to the legislation. It's one of the ways they paid for the legislation. Now, if you did the calculations, if you actually thought 90 to 95% of the population would be in this, it would just about pay for the bill. But CBO came up and said, we only think maybe 4 or 5% of the population would actually take this thing, which lowered the numbers significantly, raised the risk significantly. They started looking, well, we may have to do $100, $150 a month to try to make this work. And so they didn't get nearly the amount of money they thought they were going to get with their expectation of 90 to 95%. However, the concern was always that if they got this thing passed and it started going south on them, they would just turn around and make it mandatory. That is still the concern. That's why we got to get this thing out of there in a hurry, or else we'll have another Social Security type plan on us. And the Congressional Budget Office already says that about 10 years out, this thing is just going to tank financially. So you know it's going to be a problem. They just needed it in there to help pay for the bill. So we got to get rid of the Class Act. 1099 provision. Several Democrats today sent a letter to the president saying they want the 1099 provision repealed that allows that requires businesses to file a 1099 if they're spending $600 a month a year on any vendor. There's a fair amount of support to do that. Exchanges. I think I saw that today or yesterday, Sebelius just released money to the states to work on these exchanges. We got to get these exchanges out of there and unfund those things. I've met with a number of state legislators on there. They are in a pickle. The majority leader of the House in Colorado told me, I've got a Democratic Senate, got a Democratic governor. They want to move forward on trying to set up the exchange. I don't want to. I'd like to kill the thing. But if I don't do anything, they're going to take it away from me. What do I do? You know, if I don't do anything, they're going to start it themselves. What do I do? And it's a struggle for them to try to figure out what they do on these exchanges. But the exchanges are sort of the key to being able to make everything they want to have out there work. You get the subsidies through the exchanges, you get the controls through the exchanges, and eventually all those things would spread out to the rest of the market if we're not careful. Other thing we need to get rid of, that medical loss ratio. I think that's the piece that's around there on the medical loss ratio. This is simply an attempt to impose price controls on the insurers. Now, here's what they did with the medical loss ratio. What the President said was, insurance companies are making a whole lot of money and they're not paying claims. So let's require large insurers to pay 85% of their claims premiums on claims. Same thing's true with smaller insurers and individual market. They've got to pay 80% of their premiums on claims. And that will ensure that most of the money is going to paying claims. And if you don't hit that, let's say for large companies, if you don't hit that 85% mark, if you pay less than that in claims, you're going to pay a penalty. So now you're an insurance company. Here's your incentive. If I have to pay 85% of my premiums in claims, do I have any incentive to try to lower those claims? Absolutely not. If I lower the claims, I pay a penalty. In fact, the lower my claims, the lower my percentage of profit administrative can be. So I actually have an incentive to get the biggest, most comprehensive health insurance plans out there. That makes claims go higher. That means my percentage of administration and so forth can go up. And if something comes out, if they come out with a new software that's going to allow me to find fraud out there that's happening in the marketplace or something like that, do I want to invest my money, administrative cost, lowering how much I have in administrative cost, to do that, to lower my claims because I got to pay a penalty anyway? How do you deal with people who think like that? You got to get rid of the medical loss ratio. There's other things that need to be done in health insurance, but the medical loss ratio is not going to make it all more efficient and resolve those problems. It's just a way of setting price controls. There are investigations and hearings. God bless Darrell Issa. He wants to go out and have some investigations. I'm looking forward. That's likely to be the most interesting thing going on in Washington for a while. Now, I'm hearing stories that the leadership wants to keep a little bit of a control on him so he doesn't get too far afield. They feel like it may be bad PR if it looks like he's just going after people. But he's fairly interested in going out and trying to do something regarding that. Finally, I'll mention the regulations aspect out there. President Obama came out, what was that Wednesday, with his op-ed about how he is now the anti-regulation president. Who knew? I never would have guessed it. I thought the same thing. I thought if that's the case, Obamacare's done now. You can't make this stuff up. So he's going to be the anti-regulation president now. Well, good. Glad you're joining the team, President. But let's, it may be with his view on 2012 that he wants to try to look at making some revisions, and there may be a way that you can talk to HHS or other officials and see if there are some regulations we can begin to pull back. Now, having said all that, let me mention one of the good things that's happened from this legislation. Some insurers are developing entirely new policies that are outside of what Obamacare would cover. Guaranteed Trust in Life is coming out with a policy. I think it's next week. I've heard another insurance company is doing. And if we were out as a group saying, what would we do with insurance? If we were starting from scratch and going to create a policy, what would we do? This is pretty much it. I'll give you the example of the one that they're supposed to be coming out with. They were going to get it up to a $250,000 policy. It was starting out lower than that, but I think they're going to have it at $250,000 pretty soon. But essentially what you buy is a life insurance policy for $250,000 with a critical care component on there. If something happens and you need medical care, not a vaccine shot, not a well checkup for the baby, you need medical care, they will have a schedule and they'll just give you the money out of your life insurance policy and lower that $250,000 by that amount. It is life insurance, friends. It is not health insurance. So Obama has nothing to say about it. They even have a provision in that where and you pay all this for 20 years, so you get to pay it over 20 years. But you'll get $250,000. If you die in that time, you get the $250,000 or whatever's left. They even have a provision that if you pay a little extra, a premium, what do they call it, a premium recapture provision or something like that, if at the end of that 20 years you haven't used any of health care, you get the whole $250,000 in cash. You get your premiums back. Now, there will be a lot of pushback from the country on this because this isn't what, and people think of health care as an entitlement now. Think they ought to be able to go and get anything they want free. But it is a whole new provision that has come up as a way to try to create a health insurance policy that's different than what's available and bypasses Obamacare. And it may be that even if we have a chance to fix Obamacare, that this type of policy begins to move on and we may see that begin to expand. But at least have that on your radar screen that that's out there and may very well be our solution at some point in the future. With that, do you want to go to questions?